Hello, thank you for giving me the opportunity to share with you a little bit about the work and opportunities that we have in our department. My name is Juan Choi. I'm a professor and vice chair in the Department of Population Health in the School of Medicine here on the Medical Center campus. And as many of you know, we have three schools here. We have the School of Medicine, in which I am a faculty in. We also have a School of Nursing and School of Health Professions. And I know that this talk, I wanted to share with you about health career opportunities. Many of you are majoring in what you're majoring in because you want to enter the health careers. And I know that a lot of you have medical school in mind or nursing school, but I just wanted to cover sort of two programs that we have in our department and other careers that are related to this for you to consider. Again, there are plenty of other graduate programs and career pathways at the medical center. For example, I told you we have School of Nursing and the School of Health Professions. There's obviously physical therapy, occupational therapy. There's a whole array of health careers. And I encourage you to go on our website here at the medical center and explore all of the opportunities that you have. So I'll just jump right in and talk about our programs. As I mentioned, I'm in the Department of Population Health. This is a relatively new department that was created in July of 2019, where we merged two departments, the Department of Health Policy and Management and the Department of Preventive Medicine and Public Health. And here we have sort of the mission of our department, which is to improve health, reduce health disparities for people in Kansas and beyond. The two programs that I'll cover at the master's level for our department, first is the Master of Public Health, and then I'll talk about the Master of Health Services Administration. So Masters of Public Health, as you all are sort of are aware currently because of the current pandemic, deals with sort of preventing disease and promoting health. And our program is located not only here on the Kansas City campus, but we have a Wichita campus, but you can get the degree on either campus. And this slide shows you our degree is accredited, so the national accrediting body for all MPH programs, whether you are from a school of public health or an MPH program like ours, is accredited by a body called the Council on Education for Public Health, CEEF. And then we are also a member of the Association of Schools and Programs of Public Health. Our MPH program has two concentrations. One's in epidemiology, the other is public health practice. And again, with the current pandemic, epidemiology is you probably noticed on a lot of TVs, national and local, they have a lot of epidemiologists on television talking about the epidemic curve, how to flatten the curve. And so epidemiology is very quantitative, but it's very important in dealing with behaviors of populations and how to sort of address epidemic curves when you don't have vaccines and treatments right now. So epidemiology is sort of the basic science of public health, I would say. So the curriculum of our MPH program is a 42 credit hour degree program. It's competency based. The competencies are driven by our accrediting body, as I mentioned to you earlier. There are 21 credits of core courses, and the core courses of our MPH program covers areas like epidemiology, community health, and so forth. And then you take 15 credits of concentration courses. And then all of the MPH students take 3 credits of internship and 3 of capstone. The internship pretty much deals with 200 hours of a mentored public health practice experience. Many of our students, as we speak this semester, were placed in local health departments. So Johnson County Health Department, Lawrence Douglas County, and Wyandotte County Health Department, helping them with their projects. And given the current situation, many of them had to transition from whatever they're working on to helping out to the current COVID-19 pandemic. And then the final capstone is the 3 credits of or 200 hours of a scholarly project. And you have 3 committee members on that. You have a faculty committee member, you have someone from your health department, and then another expertise. And then it culminates in a written paper and an oral presentation. We also do have a joint or dual degree programs. We have MD, MPH, and PhD, MPH. I'll talk a little bit about the MD, MPH program. We have a lot of medical students, a lot of the students who apply to medical school. So we have sort of 2 groups. We have medical students who are currently students in the medical school who would take a year off after their 2nd or 3rd year in medical school and do the MPH in 1 year. Traditionally, MPH, if you just do the MPH, it takes about 2 years. But because of this dual degree nature, we have a more sort of concentrated, more focused way of completing the MPH. The other option we have is, obviously we have every year about 3,500 to 4,000 students who apply to our medical school. But as all of you are aware, we only accept 211. So you do the math, there are only a certain number of slots. So many of the students who don't get into medical school first go around will apply to our MPH and do the MPH first, and then apply to medical school, and then go through the medical school. So we've had sort of those models too. In terms of admissions to our MPH program, there's a software program called SOPHIS, which is a national program that everyone applies to. So if you just sort of Google that, you'll see that. You'll see we have 2 deadlines. The spring starting deadline is in November, and then summer fall start is in March. Typically, our students have an undergraduate GPA, cumulative GPA of 3.0. Now, we did have standardized tests, but at our most recent admissions committee, we decided to make that optional. So if you want to take that, that's fine, but we will not require that going forward. As I mentioned, depending on your concentration, you need the college algebra and calculus. We require a personal statement, a resume, and then 3 letters of recommendation. So this gives you an idea of what our MPH graduates do, what kind of work they do, what type of organization they work in. So you can see here, we place many of our graduates in local health departments, as I mentioned, Johnson County, Wyandotte County, Sedgwick County, Lawrence Douglas County. Many of our folks are currently working for our state health department, Kansas Department of Health and Environment. We have others who work for insurance companies, Blue Shield, Blue Cross. Many others who work in private companies like Cerner, PRA, and so forth. Others will come back and work at our medical center, working with faculty on national projects. We've also had many graduates who go on to go work for national health agencies like CDC and National Institutes of Health. And then others then pursue further education, either go on to get their PhD or MD. So, MPH degree gives you a lot of flexibility, a lot of opportunities to work in different sectors of our society, as well as pursuing further education. Now I'll jump into our other degree, which is called the MHSA, Masters of Health Services and Administration, also offered through our department. This gives you a little bit about what many of you probably already had some idea what it's about, but it's an overview. This degree gives you an overview of the healthcare system, Medicare, Medicaid, private, public healthcare systems. Also, the curriculum covers management, policy, as well as exposure to a lot of folks in the healthcare system. So this MHSA is also accredited. The accrediting body is called the Commission on Accreditation of Healthcare Management Education, or CAME. and it is a 56 credit hour program, so a little bit more than our 42 credit hour. The classes are small, so I forgot to mention our MPH program typically accepts about 25 to 30 students a year, and CAMI is about the same, 20 to 25 students a year that are accepted. It's a very interdisciplinary faculty that are part of the MHSA curriculum. We have folks who are hospital CEOs, executive, that we call executive in residence, that actually are in the curriculum. So they're sort of living the running hospitals, or chief information officers in particular, even in our own KU hospital, who are faculty teaching in this program. So you get sort of the applied as well as the theoretical aspects of running organizations. Here, it gives you some of the places where MHSA graduates have gone on to be employed. You can see there hospitals, healthcare systems, consulting, health IT, again, a lot of flexibility. But these are management, leadership type positions that our graduates have gone on to. In terms of admissions, you can see unlike our MHSA, unlike the MPH, the MHSA is fall admission only. Priority deadline is March 1, but we'll sort of take it after March 1. Again, undergrad GPA is 3.0. And you can see for yourself sort of similar personal statement, resume, letters of recommendation. Now here, for the MHSA, we do interview every single applicant. So unlike the MPH, the MHSA, we have a three member panel to interview every prospective applicant before admitting them. Again, here, just like in the MPH, we do have dual with the MD, JD, and the DPT is a relatively new one, and then MS in Nursing with the MHSA. This is our department website, so I highly encourage you to go on it to find out more information about either degrees. You can find out about the research or the work that our faculty are doing on this website, and it has other resources for you to go see and explore. These are the associations that both the MPH and the MHSA are affiliated with, our professional organizations locally and nationally. I have included here my personal email address. So I encourage all of you, typically if this was live, I really enjoy the live interactions. I apologize for just going on and just giving this sort of lecture style, but I truly like the interactive style and I miss that. But I highly encourage all of you to send me an email with any of your questions. I could just tell you from a personal story, you are all currently in undergrad. I think utilize your current professors and faculty, pick their brains about careers in health. They are a rich source of information. Reach out to me. I think if you talk to anybody, everyone's career takes different paths for a variety of reasons. Things don't work out. As I mentioned to you about medical school, we have thousands of people who apply who don't get in. They will apply again second or third time and maybe get in. Some who don't will go this route, go to public health or MHSA and have fruitful, fulfilling, enriching lives, and they enjoy that, right? So obviously I encourage you to pursue your passion, but you need to have options going forward. And so I highly encourage you to email me. I'll be more than happy to meet with you to answer any questions and hopefully guide you toward a career in health. And whether it's an MPH or MHSA or some other, I highly encourage you to explore all of these health careers. So thank you for your time, and hopefully next time I can attend in person. So stay inside, stay safe, and thank you again.